Radiation. Radiation is the emission or transmission of energy through space or a material medium in the form of ions or particles. This includes electromagnetic radiation such as radio waves, microwaves, infrared light, ultraviolet rays, and gamma radiation. Ionizing radiation can break chemical bonds and ionize atoms. Ionizing radiation is produced by radioactive materials that emit helium neutrons, electrons, and photons. Other sources include X-rays from medical radiography examinations and muons, positrons, and neutrons that form secondary cosmic rays that are produced after primary cosmic rays interact with Earth. Radiation can also take the form of gravitational waves or ripples in the curvature of space-time. Radiation can be caused by ultrasound and sound seismic waves depending on a physical transmission medium such as gravitational waves. It can also be created by gravitational forces that take the form of electromagnetic waves, such as X-rays and alpha radiation. Gamma rays, X-rays, and the higher energy range of ultraviolet light form the ionizing part of the electromagnetic spectrum. The breaking of electrons away from an atom requires high energy and is referred to as ionization. Further down the spectrum, the non-ionizing lower energies of the lower ultraviolet spectrum cannot ionize atoms but can disrupt interatomic bonds which form molecules, thereby breaking down molecules rather than atoms. Radio wavelengths below are generally not considered harmful to biological systems. Gamma radiation. It is possible to stop gamma rays by a sufficiently thick or dense layer of material where the stopping power of the material per given area depends mostly but not entirely on the total mass along the path. The air is able to absorb the energy of the particles by halving their size. The stopping power of materials with high atomic numbers, such as lead or copper, can be as little as 20 to 30% over an equal mass of less dense and lower atomic weight materials. This is composed of photons which have neither mass nor electric charge and as a result penetrate much further through matter than either alpha or beta radiations. Both beta and alpha particles have an electric charge and a mass and are therefore quite likely to interact with other atoms in their path. Neutron radiation. Neutrons are rare radiation particles and are produced in large numbers only where chain reactions or fusion reactions are active. Neutrons can make other objects radioactive. Even neutrons without significant kinetic energy are indirectly ionizing and therefore a significant radiation hazard. Thermal neutrons, even at comparatively low speed, cause neutron activation, and in fact, they cause it much more effectively. Unlike charged particles such as protons and electrons, neutrons have no charge and do not ionize atoms in the same way as an electrotonic impulse does. Neutron radiation is made up of free neutrons. These neutrons can be emitted either during spontaneous or induced nuclear fissions. Neutrons have the ability to ionize atoms directly. Only the averaging of more than one neutron is a statistically rare phenomenon that can activate a hydrogen atom. High-energy neutrons can travel for hours or even thousands of meters in the air and can travel in common solid objects. Usually, they require water or concrete to block them within distances of less than a meter. Most of the neutron's energy is transferred to the protons by the last process, much like a ball hitting another ball. The protons and other products of such reactions are directly ionizing. Ionizing radiation. Radiation is a type of radiation that detaches electrons from atoms or molecules. In high doses, ionizing radiation can damage cells or organs in our bodies or cause death. This kind of radiation has many beneficial uses, such as in energy production, in industry, in research, and in medical diagnosis and treatment of cancer, and it is safe and effective. Using a comprehensive system of international safety standards, the idea provides support to lawmakers and regulators to protect workers and patients as well as members of the public and the environment. Non-ionizing radiation. Non-electromagnetic radiation has only sufficient energy to change the rotational vibration or electronic balance of molecules and atoms. Examples of thermal ionization are the ionic fusion of a common fire and the burning of common food items induced by infrared radiation during broiling-type cooking. It is the range of all possible electromagnetic frequencies. In general, The electromagnetic spectrum of an object is the characteristic distribution of electromagnetic radiation emitted or absorbed by that object. The non-ionizing portion of the radiation consists of waves that are not sufficiently energetic to cause an electron to be tossed from a molecule. Radio waves, microwaves, and sometimes visible light are included. In fact, even non-ionic radiation can cause thermal ionization if it deposits enough heat to raise temperatures to ionization energies. All ionizing rays, including the highest frequencies of ultraviolet light, are harmful. Ionization depends on the energy of individual particles or waves and not on their number. An intense flow of particles or waves will not cause ionization if these particles or waves do not carry enough energy to ionize, unless they raise the temperature of the body to a point high enough to ionize small fractions of atoms or molecules by thermal ionization. This, however, requires relatively extreme radiation intensities. Ionizing occurs when the body is heated to a temperature that causes ionization. When a body is not heated enough to ionize, it is not generating. It occurs only when a body has been heated to 90s, to the point where it is ionized by a high dose of radiation. What kind of skin problems can radiation therapy cause? Skin may look red, sunburned, or tan. Sometimes it gets swollen or blistered. Your skin may also become itchy or dry. Don't wear tight clothing over the area that is being treated. Avoid putting anything cold or hot on the area unless the doctor tells you to do it. Ask your doctor about using sunscreen if you have to be outdoors. If that isn't possible, wear a soft cotton one. Never use tape or splints on your skin unless your doctor tells you to. Several weeks after your therapy, your skin should feel better. And even after radiation therapy ends, you still have to protect yourself from the sun. What are other possible early side effects from radiation therapy? If you have any of these problems, tell your cancer team about them so they can help you feel better. Let your doctor know if you have problems with your ears. Radioactive radiation can cause nausea and vomiting. A blood vessel. Keep healthy snacks on hand. Try eating 5 or 6 small meals distributed throughout the day instead of 3 large meals. They can help keep you strong while you are having treatment. They can also help you to eat a healthy diet while you are receiving treatment. They won't cure cancer, but they can give you a better quality of life. Radiation therapy to the pelvis can affect your sex drive and whether you can have a baby. Women shouldn't try to get pregnant during radiation therapy as it can hurt the baby. For men, radiation in the tests can affect sperm count and how well they work. If you want to have children later on, you should talk to your doctor to see if you should use a sperm bank before treatment starts. The doctor will likely prescribe drugs to help control it. They suggest changing your diet to include eating small meals more often, avoiding high-fiber foods, and getting enough potassium. They can give you medicine to control it, as well as you may be able to learn relaxation techniques and biofeedback to help control and reduce nausea. It can cause symptoms of menopause. It can cause diarrhea, which usually starts a few weeks after the therapy. If you have this problem, let your doctor know and he or she can give you some medicine to control it and advice on how to get rid of it. It can lead to a weight reduction. In men, radiation can affect the nerves and blood vessels controlling sperm. In cancer treatment, it's normal to have less interest in sex, but your sexual drive will usually come back after the treatment. Keep listening and don't be afraid to ask for help if they have any concerns. External beam radiation therapy. External beam radiation therapy can be used to try to cure earlier stages of cancer. It can also be used to help reduce symptoms such as bone pain if the cancer has spread to a particular bone area. Newer techniques focus more precisely on tumors. By doing so, doctors can give higher doses of radiation to the tumor while reducing the radiation exposure to nearby healthy tissue. Each treatment is like an X-ray. Usually the procedure is painless, but the radiation is stronger than that used for an X-ray. All treatments take a few minutes, although the time required to get you in place takes longer. You will usually go for treatment 5 days a week in an outpatient center for at least several weeks, depending on the reason for the radiation. Possible side effects of these problems usually improve over time, but some men just don't improve. After treatment, some men develop urinary incontinence. They can't control their urine or dribbling. It occurs less frequently with radiation therapy than after surgery. The risk is low at first, but it goes up over time after treatment. It is sometimes used to put a balloon between the rectum and the prostate before treatment, to act like a spacer to reduce the amount of radiation that reaches the cervix. Sometimes this can lead to diarrhea with blood in the stool and renal failure. Most of these problems disappear with time. Normal intestinal function is not restored in rare cases. You might need to urinate more often, have a burning sensation, or find blood in your urine. There are different levels of incontinence. The risk of this happening is low after treatment, but it can increase each year after treatment. After a few years, the impotence rate is about the same as after surgery. Some erection problems usually do not occur immediately after radiation, but develop slowly over time. Urethral stricture is when the urethra becomes very narrow, or even close to it, which is usually due to a bladder problem. Maybe it will need more treatment to open it up again. The genital area. Lymph nodes provide a way for fluid to return to the heart from all parts of the body. If the lymph nodes around the prostate are damaged by radiation, fluid can accumulate in the legs or genital area and cause swelling and pain. Although it may not go away completely, lymphedema can usually be treated with physical therapy. It can cause severe fatigue, which might not go away until a few weeks or months after the treatment starts. To cure or shrink early-stage cancer, it can be used by itself to make the cancer shrink or completely disappear in these cases. The first treatment may be chemotherapy or other non-cancer drugs. The radiation used to shrink the tumor is called preoperative therapy or neoadjuvant therapy for other cancers. Anti-cancer drugs and radiation can help each other work better than they would alone, according to research. One drawback is that side effects are often worse when given together. Certain drugs called radiosensitizers help radiation work better by making cancer cells more sensitive to radiation and can be used alone or in combination with radiation. For some cancers, radiation and chemotherapy may be used in combination. Intensity-modulated radiation therapy emerged. In prostate cancer, it is the most commonly used type of external beam radiation therapy. The machine is computer-controlled and moves around the patient as it delivers radiation, along with shaping the beams and aiming them from several angles at the prostate. The intensity and strength of the beams can be adjusted to limit the doses of radiation reaching nearby normal tissues. Some newer radiation machines have imaging scanners. The doctor can take pictures of the prostate just before giving the radiation to make adjustments to the aiming. This seems to help deliver the radiation more precisely and results in fewer side effects. A variation of this is called volumetric modulated arc therapy. It uses a machine that delivers radiation quickly as it rotates around the body once. Using this technique, each treatment can be given in a few minutes. How is radiation therapy given? Radiation therapy can be given in 3 different ways. External radiation or external beam radiation uses a machine that directs high-energy rays from outside the body into the tumor cells. Internal radiation is also referred to as brachytherapy. A radioactive source is placed inside the body or near a tumor. For certain types of cancer, systemic radiation is given by mouth or in a vein. These drugs then circulate throughout the body. For a period of time after these drugs are given, you may have to take special precautions. The type of radiation you might get depends on the type of cancer you have and where it is located. It is usually given over a long period of time and can be given twice a day. It can be done during outpatient visits to a hospital or a treatment facility. An external radiation receiver is not radioactive and has not to follow special safety precautions. For this type of radiation, special safety measures are needed for a period of time. Your cancer care team can answer specific questions about the type of radiation prescribed for you and how it affects your body, and any possible precautions that may be needed to protect yourself. There are some cases in which more than one radiation type is used. Brachytherapy, internal radiation therapy. Brachytherapy is generally used only in men with early-stage prostate cancer that is relatively slow-growing and low-grade. It is sometimes an option for men with a higher risk of the cancer growing outside the prostate combined with external radiation. There are 2 types of brachytherapy for prostate. You will either have spinal anesthesia where the lower half of your body is numb, or general anesthesia where you are asleep. You might be required to stay overnight in the hospital. Computer programs can calculate the exact radiation dose needed. There are two types of brachytherapy for prostate cancer. Both of these are performed in an operating room. Neither type of brachytherapy has any side effects, but the second type may have some side effects. Sometimes it doesn't work as well in men with large prostate glands because it might not be possible to place the seeds in all the correct places. Can brachytherapy be used to treat cancer? It is a form of radiotherapy used in the treatment of cancer patients. It is used to treat a variety of cancers, include stomach, bones, skin, and face. It is also used to treat the skin on the face and neck. Possible risks and side effects of brachytherapy. During several weeks or months, the seeds will release small doses of radiation. This time, your doctor may advise you to stay away from pregnant women and children. There have also been reported that the seeds have moved through the bloodstream to other parts of the body, such as the lungs. Bowel problems such as redness, burning, or diarrhea can sometimes occur with serious problems but are uncommon. When traveling, you may want to get a doctor's note regarding your treatment, as low levels of radiation can sometimes be detected at airports. During the first week or so, you may be asked to strain your urine to catch any seeds that may come out. During sex, you may be told to take other precautions such as wearing a condom. These precautions aren't necessary after brachytherapy because the radiation doesn't stay in the body after treatment. According to doctors, this is uncommon and does not seem to cause any adverse effects. Sometimes it can irritate the rectum and cause radiation proctitis. There's also the possibility of bleeding and diarrhea. Severe incontinence and trouble controlling urine is not a common side effect. This can be worse in the weeks after treatment and improves over time. Treatments such as those listed in the surgery section can help with erection problems. The younger you are and the better your sexual function is before the treatment, the more likely it is that you will regain function after the treatment. The better your sexual health is, the better you will be after treatment. Thank you for watching. Do subscribe, like, and share.